Your time now is 6:23. You know, every Halloween season, thousands of people are sent to the hospital for injuries associated with pumpkin carving. Joining me this morning is Dr. Kathleen McKeon from Andrews Sports Medicine and Orthopedic Center. Thanks so much for being here.
Thank you for having me.
So many people do. They get invited to pumpkin carving parties, but you say there's a lot of injuries associated with this. What are you seeing?
There are. It's primarily cuts or lacerations from knives. So people are using very sharp knives in thick pumpkin skins. The knives get stuck, they get caught. People are jamming at them, trying to pull them out, trying to twist them, and all it takes is one little slip. And a sharp knife, can really do some serious damage in a hand.
So what's the difference between a laceration and a puncture?
A puncture would be what we would call sort of a small laceration. Either one can be dangerous. So if you have even a small cut in your hand, the tendons and nerves are very close to the surface in your hand, and you can do some serious damage even though it may not look bad on the surface.
That's what I was going to ask. So say you're carving a pumpkin and you get a laceration or a puncture. What should you do?
First thing you should do is hold pressure. Then you want to wash the wound out with some warm soapy water. Just make sure you get anything out of there that might have gotten in from your pumpkin. And then once you've got it kind of cleaned out, hold some pressure, make sure the bleeding stops, and then just put a Band-Aid over it. The times you need to go to the doctor are if you can't control bleeding after you hold pressure on it for about 15 minutes, or if you have a patch of numbness, or if you can't move your fingers normally after that, because that could be a sign of some deeper injury that would need to be evaluated.
Yeah, like a ligament or something like that.
Yeah, like a tendon or a nerve. All those things can be cut, and those need to be surgically repaired. They won't repair themselves on their own.
Oh my gosh, you could be literally scarred from this.
You can. Yeah, you really do need to be careful.
So what are some safety measures? What do you recommend? Obviously, kids probably shouldn't be doing this.
Absolutely not. Yes, children need to be very careful with this. Best things to do are have your kids draw the design on there, or have them scoop out the seeds, but then have the adults do the actual carving. Do it in a well-lit area. Certainly don't do it while drinking alcohol. That, again, should be obvious, but you'd be surprised. The pumpkin carving kits that they sell in stores have more flexible, sort of serrated blades that are often much safer, so we always recommend getting pumpkin carving kits. That's always a good idea as well.
Yeah, and I'm wondering, you know, these knives, it's hard. Sometimes the knife slips. Pumpkins have like a slippery surface, and people don't realize that.
That's right, they do. So you also want to make sure the blade is always facing away from your hand. So if it does slip, at least it slips in the right direction and not towards you.
Or people could do what I always do, is just draw a happy face on the pumpkin and call it a day.
That's right, yeah. Happy faces, paints, all sorts of colors also would be great.
All right, well, thank you so much. And of course, if you need more information or resources to how to carve a pumpkin carefully and not to injure yourself, just go to their website, and I want to get that right, sportsmedicine.com.
AndrewsSportsMedicine.com.
AndrewsSportsMedicine.com. Thank you so much, and let's carve with safety this year.
Absolutely.
All right, Jamie, back to you.